nhom trong man vạ sang màu viêm rích pro vạ sang am rích mình đang hà lo mình lo bên đây nhom tục chất lợp tê hầm rích
cô bụng non bọc nhom tốt cứ nhom chui chất am rích trần chiều vừa đại sa nhom vậy thì bụng chẳng cứ bờ tê am rích cứ chưa bờ tê rợn lại mồi hay là muối cứ bong đang xẹp ấy tha ở lại ní am rích có cột chụp bị bạt corona này hay bị chi chôn nơi am ríchហ្នឹងslap tràn và tại con ai là cho mục năng cho người này bàn chẳng nói nhom ai bảo sân chỉ miền và sang mà về America nhom thằng ai chả cứ nhom tọt miền order bị cầm home online muối bịประเทศchấn phần ta giờ hôm tới cứ đầm lấy cứ xong rúm ai thì tôi cho bán và ta quality này product này nhom vô màu nó cứ việc việc xong nó đầm lấy để vô màu mình chấn là về để nhom order product máu cứ nhom orderตัวbàn ở vậy để chia với chấm miền ở vậy để chia ca đồng phân tục bảo nhóm cứ việc cost lại chẳng ấy thôi nhom việc khoa học một chất là tập hợp bọc tiệt chân nhom tại cái tha đồng phân tha Cambodia nông miền và sang chạp đấy của đề xa ta hiện trán miền ốc nhà trán đấy còn là bán bò chả hay nhom có bán showroom là đây nơi con scan ở Việt Nam hay nhom sản phẩm than về Cambodia nông miền và sang đang chạp
bà sân chia về Cambodia dướng miền và sang Covid đâm bốn nhom phồng chạm bò nhom vô và sang mà bị tây America Covid năng vì trách mà bị tây chân chẳng nhom lên sơ miền tầm nục chất lượng tây chân tia đó bò chẳng nhom vô về tây America bà sân chia miền
And I have a Doctor of Pharmacy degree from a university in California. And I worked in the pharmacy industry for about 15 years in the States, and then worked 2.5 years for an NGO in Cambodia called Pharmaciens Sans Frontières. That's Pharmacists Without Borders. So usually the drug approval process for blood pressure medications, this sort of thing in the States is very slow and laborious and just often takes years and years before a drug is approved. If a vaccine is recommended, be the first one in line ready to get it, sure. Certainly if I had a choice, I would choose a vaccine from a Western country as opposed to one coming from China, primarily just because I'm familiar with Western drug companies, and the Chinese drug companies, I know them by name and I read about them, but I'm not real familiar with their products or their track record or what their regulatory process is, how they get things approved. It's just quite a bit different from what I'm familiar with in the West. So if I had a choice, I would certainly take a vaccine from a Western company. You get the discussion between Western medicine and Eastern medicine. I think Eastern medicine in general has a lot to offer the West. In terms of these vaccines, particularly the COVID vaccines, I think that the Western medical process I would have more faith in than what I see coming from China. Certainly what I've seen is when Khmers go into a pharmacy to buy a medication, they'll want to buy the best that they can afford. And if it's a choice between a Western product and something that's either made locally or made anywhere in the East, they will go for the Western product for sure. I mean, I've seen that over and over again, particularly if they can afford it. If they can afford it, they will always spend more money and get what they perceive as being the better medication, which is something has a Western name on it. A lot of people that I know, they perceive the Western medications, because they're probably more expensive, as being superior. Certainly the regulatory process, the approval process in the West, the States, Great Britain, is very strict, and it's it's a real step-by-step thing, and you have to go through every step to get things out on the market. I don't think you see that same rigorous standards with Chinese products, and so I mean you go into any of the pharmacy here and you see that even the pharmacies that are directed at Khmer consumers, they'll tout the products with the Western name on them, and those are the big sellers. Those are what people want to purchase. You know, I'm glad that the Prime Minister has decided to go with WHO, because he wants to work with the COVAX facility, and that's WHO and the EU and the French government. So he's going with some very respected institutions, making sure that the vaccine given in this country, it's given in Cambodia, is considered, the best one available in the world. So I think that's why he made the decision. He wants the best for Cambodia.